One of the most common ways that men report symptoms of testosterone deficiency in terms of fatigue is they say, I feel totally exhausted. I feel exhausted in a way that sleep won't fix, in a way that, cutting back at work won't fix. It's an overwhelming, pervasive feeling. And so, what we'd expect in someone with true testosterone deficiency is that giving them testosterone should improve that. What happens though when you're put on TRT and your fatigue not only does not improve, but actually gets worse? What if it gets markedly worse, in fact? So I'm going to go over the most common reasons at the end of this video. But first, I'm going to explain the most dangerous reason and the most poorly understood, and the reason that I've never seen heard talked about on any of these social media platforms, despite many of the self-styled experts on these platforms claiming to be experts. Usually they're barely high school educated. But if you follow me on Patreon, I've been talking about the mitochondrial model of chronic disease. Okay. My Patreon is going to be linked below, so I won't go into the details of that. But the short answer as to why TRT would cause or worsen fatigue has to do with a concept called allostatic load. Allostatic load. Okay. This is a term that was coined in 1993 by McEwen and Steller to describe the added energy cost that's imposed by chronic stress. For example, from internal reasons, you have a heart failure that's worsening, you have maybe Parkinson's disease or vascular dementia. There's any number of things that could be the underlying culprit. It can also describe added energy demands from psychosocial stress. You're going through a divorce, you recently had a person in the family die. So it doesn't just mean purely physiologic. It can also be psychic, so to speak. But what fatigue represents, essentially, in the context of TRT, when it appears after someone's on TRT, is it signals that there's an insufficient usable energy, which often reflects mitochondrial inefficiency or dysregulated energy signaling. Okay? Androgens, what they do is they stimulate mitochondrial biogenesis and they increase metabolic activity in skeletal muscle. Okay? In TRT candidates, good candidates, this is a good thing because greater metabolic activity in skeletal muscle, to put it in very layperson's terms, it gives you better blood sugar control and better overall outcomes in terms of things like obesity and metabolic syndrome. That's why testosterone, contrary to popular belief, can be used as a tool to treat metabolic syndrome in some, but not all, but some men. However, there are some men where it appears that the increased peripheral energy demand and the increased systemic energy allocation applied to skeletal muscle can actually unmask central fatigue, okay, if their total energetic capacity is limited. If you want to learn more about energy budgets and energy resistance, I'd encourage you to go to my Patreon, again, link below. The article is called Energy Resistance Number 1. It's free. You don't even need a login. You can just read it directly off the website. So in the case of patients on TRT, we can say one thing with absolute certainty. TRT should never increase your fatigue. Okay? TRT should never, I repeat, never increase your fatigue. Your fatigue before you go on TRT, when you go on TRT, should either be improved or, at minimum, definitely not worsened to any significant extent. Now, there are many exceptions to this, okay? There are many exceptions to this. Number one is, well, just because you're on TRT doesn't mean you couldn't have developed some kind of chronic disease, like you had heart failure, maybe your heart failure worsened. You have COPD, maybe your COPD worsened. I mean, those things can happen. Those things can and do happen. You can get sick, you can get ill, all right? You can also go through major life stressors. I mentioned divorce, issues related to that, major life transitions that are not like something you worry about for a day, like you have a test coming up at the end of the week at work or at school, and it's like you're stressed about that and that makes you a little bit more fatigued. I'm talking about more like weeks to months, chronic and especially worsening fatigue. There are certain psychosocial events that cause a great deal of rumination where you're just constantly thinking about it, and that consumes a great deal of your total energy budget. And as a in point of fact, it increases allostatic load. Again, I talk about this on Patreon. Other things, though, TRT can cause development of a transient sleep breathing disorder. It can. A lot of people think TRT can cause sleep apnea. That's actually not true per se. TRT can cause what's called emergent central sleep apneic episodes. And the layperson's way to understand that is in the first 3 to 4 months of testosterone treatment, your sleep can worsen. It can. It can, but it's not an obstructive type of sleep apnea. It's more of a central type. But there's at least 2 major studies that show after 4 months that effect should be abolished. And if that was the reason for your fatigue, it shouldn't be an issue anymore. Another common reason is overdonating blood. It's very commonly understood TRT increases your red blood cells. If your red blood cells get past a certain point, in our clinic, we use a hematocrit cutoff of around 55% for most patients, not all patients. It has to be individualized. But if you phlebotomize people or force them to donate blood at lower thresholds, this can cause iron deficiency. And iron deficiency, which is commonly associated with anemia, but you can get iron deficiency without anemia, and many TRT patients do get iron deficiency without anemia. This can cause fatigue. Okay, so these are examples of things that are either pretty quickly reversible or treatable. But what are some other reasons TRT may directly cause or worsen fatigue? Well, number one, you could have a dose that's too low. I have to say that's not common. The most common situation where you would find that is in someone using like a low dose gel. Okay, 20% of men don't absorb gel, something around 20 to 30%. So in this situation, they're not really, their testosterone levels aren't really going up all that much, and their hypogonadism / testosterone deficiency isn't being treated. Okay, so their fatigue doesn't get better, and if it does, you stay on the gel for long enough, it tends to worsen. Okay. Another reason is the dose can be too high. This is far and away much more common than it being too low. A dose that's too high represents the phenomenon that I was just talking about, increased allostatic load. It's a symptom of, in layperson's terms, your body stealing energy from other parts of itself to go into your skeletal muscle. Okay, so unlike great apes, okay, we are great apes, but unlike say chimpanzees, most of our mitochondrial density is buried in our hearts and in our brains. It's not supposed to be buried in our skeletal muscle. So it is possible that diverting too much energy or creating too much energy demand in skeletal muscle can unmask a central fatigue. And if that's the case, that's very, very bad. That means you need your dose reduced. Okay. Another reason could be that your dose is just inadequately spaced. You have an improper dosing interval because especially when you give yourself injectable testosterone, you typically get a very rapid spike in your levels and then they fall off, and then you inject again and get a rapid spike. And these are called peaks and troughs. So you can get peak to trough effects that can cause transient fatigue. But again, this is transient fatigue, such that, someone who experiences this would be like, okay, in the first few days after my injection, I feel really good, but then I feel pretty not so good as the days go on towards my next injection. Okay, we can identify that pretty easily. But if all those things are excluded and the fatigue is just there and it's persistent, and you've had all these dose adjustments and you've had your routes changed and everything, there is a small possibility that frankly, you just may not be a good TRT candidate. You may be someone who responds very poorly to TRT, and you should be tapered off the TRT if that's the case. Thanks for watching. The clinic website is b3clinic.com, which is also linked below along with my Patreon.